Hi guys, welcome back to my channel. My name is Marvelous Akimu and I am currently a third year medical student of Delta State University. And so this is the third part of these 30 advices for preclinical medical students, especially those in 200 level or those who are just entering 200 level. So if this is the first video you are watching, do want to watch the part 1 and the part 2 of this video so you can get a glimpse of everything I've been talking about. So are you a 200 level medical student and you really don't know what to do and you just stumbled upon this video? Thank you for tuning in. Do well to hit the subscribe button so that you don't get to miss out on any other videos like this I'm going to be posting. And for my returning subscribers, thank you so much. Alright, so we'll be going straight to this video. Okay, so I'll be giving the last set of 10 advices for preclinical 200 level medical students, especially those who just got into 200 level. Alright, so the first advice I'll be giving is balance medicine and life. Okay, trust me, you might not hear this, but thank God you are watching this video to hear this. You were once a human being before you became a medical student, but a lot of persons forget that they were once human before medical students, and because of this they end up doing the medical related stuff, leaving the human related stuff. So what am I trying to say? There are things you do or there are things you did before you became a medical student, your hobbies, things you loved doing, and so many stuffs. All right, but now you're a medical student, you dropped those things. Now I'm not saying that you should keep on doing all those things and leave medicine, but what I'm trying to say is strike a balance. Okay, so you see some persons who probably before they were medical students they had a skill, probably graphic designing or writing books or a lot of skill, but when they get into medicine they'll drop it because of medicine. So take this scenario. So some time ago someone came to me and was like, I don't go to church again. And I'm like, oh, why you don't go to church? Since when? The person was like, because I need to read as a medical student. I was like, for real? You need to read as a medical student and that's why you're not going to church? As funny as it is, but trust me, medical school will push you to that point if you don't learn how to strike a balance at the early stage of med school, which is now. So now you are just coming in, learn how to strike a balance between medicine and your life, that no one suffers. So you will not enjoy life and medicine is suffering, or rather you will not enjoy medicine and your lifestyle is suffering. You just cut off from everybody, cut off of all the things you are doing, your hobbies, what you like doing, the skill you have, everything, your relationship with God, you end it because you're studying medicine. It's a very wrong path to take. So ensure you balance. And the next one is avoid comparison syndrome. Jesus Christ, this is so important. See, this advice is something that will keep you strong in medical school. When you hear comparison syndrome, you run away from it. Don't try to be part of it, okay? Because trust me, there's this analogy I used to give. Medicine is like a marathon, all right? And so it's a marathon that looks like a sprint. It's a marathon that looks like a sprint in the sense that, you know, when people run marathon, there's nothing like lane. This is my lane, this is your lane. Everybody just runs like that and kind of cluster, and they'll join together, that kind of thing. Unlike a sprint where they have their lane. So it is a marathon, but in that marathon, everybody has their lane, everybody has their pace, everybody has the style of running. So know your lane, know your pace, and know the style at which you are running. Don't look at someone else's style, someone else's pace, or jump to someone else's lane, because if you do that you end up being disqualified. So you get the analogy. So try as much as possible not to compare yourself. The truth of the matter is there are some set of people that till you graduate you might not be smarter than them, and it's just something that you must admit on time, because it will save you a lot of stress, because at the end of the day you start comparing, and when you compare it will lead to unhealthy competition. And trust me, when unhealthy competition sets in, you see that you start reading just to impress and not reading for the main purpose, which is to know this stuff, because eventually you'll be saving lives in the future. So you will not do competition on how you'll be saving life. Alright, so try as much as possible to avoid comparison syndrome at the early stage, which is now. The next advice is stay curious beyond and before lectures. Alright, so before you go for a lecture, try as much as possible to glance through everything you'll be doing in that lecture. Alright, so you see a particular lecturer's name. So I assume that every school has a lecture plan, alright, and a lecturer that is supposed to take that particular topic. So if you see a particular lecturer's name and you know that this lecturer is taking this particular session of the scheme, do well to have a glimpse of everything. Alright, have a glimpse, read through. Okay, it is like this, it's like this. Now this helps you a lot, because by the time you get to class the following day or whenever you have that class, when the lecturer is talking, you see that there's this confidence you have, because most of what he's saying, you read it, okay? And it will also help you in the sense that if probably when you were reading you did not understand, what the lecturer is going to say is going to give you understanding. That's two. And thirdly, in case you have a question, you can as well ask that question, because you see most of the time we don't get to ask question in class. This is because sometimes we don't even understand the concept. But trust me, when you read from before the class, you see that there's this curiosity that will set in. Like, why is this thing like this? And as a medical student, you must always ask the whys, because at the end of the day, most of the questions that come out in the exam are the whys. So if your school is like my school that prefers to set clinical oriented question rather than just what is, then you must know the whys of concepts. You must know the whys. Next advice is use your senior colleagues wisely. You see, there are a lot of medical students who don't make use of their senior colleagues, and trust me, if you're a medical student and you don't make use of your senior colleague, then I must tell you that you are making the wrong choice, because trust me, your senior colleagues have passed through this phase before, and so because they have passed through this phase before, they have more experience, and so you don't need to figure out things again. You just need to go there and be like, oh, send me the template, please, I know you have passed through this phase, send me the template, let me use it to build mine. Don't start building from the beginning again. I see a lot of medical students do that. At the end of the day, what this will help you do is that to shorten your study time. So a senior colleague might just tell you, this is how it is done, like this. Use this material, use this textbook, read this past question, do like this. And at the end of the day, you see, it makes things very easier rather than you trying to figure everything from the beginning again. So make use of your senior colleague wisely. Then the next advice is don't joke with practical classes. You see, a lot of students enjoy theory to practical, but trust me, I prefer practical to theory. In fact, theory becomes so boring sometimes, but I don't think there's a particular time where practical becomes so boring, because you are doing it, you are seeing it. And when they say, okay, this thing will change to red, and you look at it and you're seeing it changes to red, it gives you this mental image that you wouldn't forget for a very, very, very long time. I tell you that there was a practical we did in secondary school. Filtration, that's practical. The way we carried out that practical, the spots we used in the laboratory, the equipment and everything we used, I can still remember every single thing. And that is like 6 to 7 years ago, a very, very long time, but I can still remember everything. So this to tell you the power of practical. So don't joke with it. Don't say, I'm not going to go for this practical class because it's not that important. At the end of the day, when you become medical doctors, what you will be doing is more of practicals than theory. You might not even have time to even be doing any theory again, except you want to become a lecturer. But what you'll be doing more is treat live patients, and that is practical. So if you skipped it, then the next advice is protect your mental health. As a medical student, anything that will make you emotionally down, try to run away from it, because trust me, when you are emotionally down, you can't read. And when you can't read, you can't understand. And when you can't understand, you can't answer question in exam. And when you can't understand question in exam, you can't pass. And when you can't pass, you can't go to the next level. And when you can't go to the next level, you eventually fail out. But try as much as possible to always monitor your mental health. Am I normal? Am I okay? Is my mind peaceful? Just try to ask yourself these questions, because this will actually help you. You see, that is another cheat in reading, right? When you see, the time that you most understand your concept is when you are happy. You see that the time that probably when you are down, you're not trying to force yourself to read. You see, the stuffs will not enter. But you see that moment, probably your mom just sent you one free 50k, maybe it's not your allowance, it's not just dash 50k, you'll be so happy. And when any book you carry to read shut down, you will destroy the book. So try as much as possible. This is another cheat code, that you should ensure that your mind is at rest and peaceful before you start reading. Not you are thinking of, hey, CA, did I pass my CA? This one pass me, this one do like this one. At the end of the day, you just fill your mind with so many things, burdens that will be so heavy for you, and at the end of the day, you will not be able to read. So try as much as possible to monitor and protect your mental health. And the next advice is stay spiritually grounded. In fact, this is one of the most important advice I can give to any student. Stay spiritually grounded. See, there are a lot of benefits. Staying spiritually grounded as a student, because God will definitely help you. That is it. God will definitely help you. You hear a lot of theories that if you pray and if you don't read, you will fail. Yes, but what I'm trying to tell you is play your part. Play your part and you will still remain spiritually grounded. You will excel more than the person that just played parts without being spiritually grounded. You can try out the experiment and confirm. So me saying being spiritually grounded to you now is not saying you should be spiritually grounded and forget to read. But what I'm trying to say in essence is read and also be spiritually grounded. So the next advice I'll be giving is consistency. One of the attributes that will make you remain strong as a medical student is keep on showing up. Keep on remaining consistent. It's not just about I read 12 hours yesterday and you that have been reading 2 hours, 2 hours, 2 hours every day. Because someone read 12 hours yesterday, you become depressed. Trust me, you will do better than that person who just read once 12 hours. So consistency, keep on showing up. That is just what med school is all about from what I have seen. Then the next one is plan for exams early. And somebody will be like, how will I start preparing for exam I'll write in 6 months from the first month? How is that possible? But trust me, in med school you will see it happen. Preparation ought to start now, and that characteristics must be seen in you as a medical student. Try to start your exam preparation on time. So the last advice for this video is remember why you started, because we have reasons why we got to med school or why we are in med school. It should be something that keeps you going. So we have a lot of reasons, and so this should be one of the source that keeps you going. So when you're emotionally down, just remember, oh Jesus Christ, I started this because of this reason, and so because of this it gives you this continue. And trust me, with all this said, this 30 advice, you will survive, and you will not just survive as a medical student or a preclinical student, you will excel, because it's something I have experimented, both the bad ones and the good ones, and I can tell that if you follow this path, you will definitely succeed. So if you love this video, do not to hit the subscribe button, make sure you like this video and comment. Tell me, let me know, was this video helpful, and the other series of video I dropped, that's the part 1 and the part 2, if it's really helped you, do want to indicate in the comment section. Until we meet you again in another video. Bye guys.